Um, Hi everyone. I think I see some familiar faces. Try to lower down the screen so that doesn't. See some familiar faces. Some of you have known me for a very long time, but hello, my name is Dr. Joon Lee. I've been doing this for sometimes 15 years now. I started upstairs in a sublease as Scarsdale Integrative Family Medicine. You guys see me transition through Scarsdale Integrative Family Medicine to See Beyond Medicine. And when I did that transition, I did it with a vision of people being able to see beyond their medical diagnosis, their age, their weight, whatever their chronic illnesses are, and be able to hopes and possibilities beyond what conventional medicine actually offers. You're not on mute. If you guys can mute yourself for a little bit, I'm going to try to make it an interactive session so that we can actually talk about stuff. But for now, I'm going to mute it so that we can start. I want to start the whole talk by asking, what do you guys think of aging? Is aging a normal physiological change, or is aging a disease process that varies from people to people? So we're going to try to take a poll, I'll launch it, and then see if people can vote. You can vote on your computer or your phone. That would be great. What is aging? It's a disease, or it's a normal physiological change? Then I have a second question here. Who wants to be a centenarian? Who wants to live 100 years or more? We'll have people vote. A few minutes. Okay. Hi, Kevin. How are you? For joining in. You didn't miss much. We were just trying to take a vote on what do people think of aging? Is it a disease or it's a normal physiological change? And who here wants to live more than 100 years? All right, so I'm going to end the poll here. So 5 out of 5 of us thought it was a normal physiological changing process, and 2 out of 5 of us wants to live beyond 100 years old, and 2 out of 5 of us wants to live over 90 years old, and just one of us said no, like I'm going to live to wherever I want it to be. All right, great. All right. So I'm going to argue here that aging may be a disease process. Although it is normal and it's normal for us to go through it, everybody's experience on aging actually differs. That's why when we go to our high school reunions and college reunions, some of us look like they're still in their 20s, and some of us look like they are aging far beyond where we should be. Gray hairs and skin changes and whatever it may be. So why does it differ? If it's a normal physiological process, then everybody kind of should look the same at 40 or 50 or 60 or 70. We're going to talk about determinants of aging and why is it that we differ, and perhaps argue that maybe it's a bit of a disease process that we can maybe control. Second question, people who answered that they want to live beyond 100 years old, I'm going to ask the question back to you on, is it really meaningful to live beyond 100 years old if your functionality decreases around 75, 80, and you're immobile or you're bedridden because you had a stroke or whatever it may be? So I'm going to argue back to you guys that it's not really the years that matters. It's actually more how healthy and how much you can keep your function that matters more. Talk about the difference between lifespan and health span. Lifespan may be 100, but if you can't sustain your functionality until 100, then it really becomes a meaningless thing. So that's where I wanted to just provoke some thought process, and feel free to chime in and ask questions and talk. I don't want to be the only one that's talking throughout the whole talk, but let's go to the next one. I'm going to close this out. So when we do go to our high school reunions and college reunions, what do we notice that's actually different from one to another? I think a lot of us sort of associate white hair with aging process, the laxity, the posture, the straighter you are. And part of that is bone deterioration, muscle deterioration, and also fat distribution. This is one of my favorite painting from Gustav Klimt, where our fat distribution changes from when we're a little girl to a woman to when we age. A lot of our fat distribution starts very heavily abdominal centric. Then you're going to notice some joint deformities in some people, whereas some people might not have that degenerative structural change. The question goes, can we do anything about it, or can we actually down? Right, but what about the things that we don't see? What about the invisible inside part that we actually feel, right? That's very different than what we see outside. But as we age, we do suffer from like non-visible changes within ourselves, where we used to be able to eat McDonald's or fried chicken or fast food and be able to digest all that food. Those food really starts becoming yuck. Can't digest it, and then we end up like suffering from the consequences of eating bad stuff, whether it's diarrhea or constipation or acid reflux, or just feeling like you can't digest that food. And then our brain neurotransmitters also starts coming out. So things that used to not bother us now suddenly bother us. Sleep that used to be so sweet and easy becomes a little bit difficult. And not only that, our immune system definitely end up suffering from urinary tract infection or flu or pneumonia or COVID differently because of our aging process. But even within the same age bracket, we've seen this through the pandemic, where my neighbor, 70-year-old, did COVID just fine and was asymptomatic, or my friend, 70-year-old, really nearly died because of COVID. But we also saw it in younger age people, where they're 20 years old and 30 years old and still died, right? So that's called immune aging. There is a process in which our immune system does age. Our cells, our cytokine, our senescent cells adds to the inflammatory burden, and everybody's immune system differs based whether or not you're going through accelerated aging. And last but not the least, hormonal changes definitely affect us after 50 in average. Like for women, menopause, loss of period, loss of vaginal lubrication. For guys, andropause way earlier, but loss of libido, stamina, erection, all of that definitely changes our body and like decreases our secondary sexual characteristics that we develop throughout our teenage years. So if you go to a nursing home and see people sitting around from the back, you're really not able to tell whether that's a boy or a girl because you lost sex hormones. Now, the science behind all of that is what's going on behind the scene is deregulation of nutrient sensing, disruption of protein balance, intercellular communication, stem cell exhaustion, mitochondrial dysfunction, telomere shortening, cellular senescence, which is those zombie cells that has replicated like 50 times. So you lost its function, and it's just adding to the inflammatory burden of our body. Some genetic instability and epigenetic alterations that we actually can control based on what we do. There we go. So we kind of talked about this. I'm not going to do it again, but structural damage, cumulative wears and tears, functional decline. But the important word here is functional. If you can function, if you can walk, if you can do the things that you enjoy doing, playing tennis, some of my tennis friends in here, you know, whatever it may be, then you're really going through healthy aging as opposed to accelerated aging process. There's that biological aging process. There's the psychological aging process of feeling down more easily and whatnot. And there's the social aging process of retiring, moving community, life cycle changes, all of that factors into aging. So I've been asked, like, how much of this is genetic, and I'm gonna venture to guess it's about 25%, but it's not just genetics, right? Bigger portion of this is actually our environment, our lifestyle, who are we with, which community do we belong to, and even personal characteristics, like female lives about 7 years more than men. So if you're shooting to live to 90, for those of you, your female spouses are going to live to 97. Ethnicity, socioeconomic status, all plays a role. So how we, hold on, I went too fast. Wait a second, I'm giving up all my slides. Here we go. So how we differ in looking at aging as a disease in this practice is because we look at not the organ system, but we actually look at the root causes. Common diseases associated with aging is very much organ-based. COPD, diabetes, hypothyroidism, menopause, andropause, lymphocytic colitis, constipation, fecal impaction, depression, anxiety, and insomnia, arterial stiffness going up and getting high blood pressure, immune system going down. We talked about strokes, and dementia is a big one. Cancer is a big one. At any rate, the way you look at disease process is going to make a difference in whether you're going to be able to reverse the aging process or not. So I would argue that instead of looking at an organ-based system, if you actually look at the functional assessments of all the biomarkers and genetics and look at it in a different lens of where did this come from, macro and micronutrition, like physical activity, sleep, energy system, spiritual and social balance, that you will be able to control this process just a little bit. So treating one disease at a time really has very little impact on lifespan. That's why we haven't been able to get a handle on heart attacks and strokes and cancer, and people, pass away with those chronic illnesses. But if we look at how this intricate spider web of GI system, defense and repair system, energy system, toxicity and detoxification, transport, communications between the cells, use of hormones and neurotransmitters and immune messengers, and also look at the structural integrity, maybe we have a chance of tackling this a little bit better. And it's not that complicated, honestly, but I'm going to sort of dissect it down so that you guys can understand it better on concrete how-tos. So one thing that we do here is that we do comprehensive physical exam like any other internist's office, but we do have a skin analyzer to sort of analyze your skin age. Often send people for bone density and DEXA and look at bone age. We have an in-body here that checks your body composition analysis to see where your fat distributions are. Is it abdominal centric? Is it balanced out? We do artificial, clearly enhanced CCTA to look at your heart age, your blockages prior to it actually being blocked. So that's a bit of a prevention medicine here. Lung disease can be checked with PFTs. I have a huge sort of like passion and emphasis on brain age, because I do feel like if we don't have our minds clear, then rest of it really doesn't matter that much, right? So brain age, we do check our brain neurotransmitter testing. We use validated questionnaires like mini mental status exam. We do PHQ-9 to screen for depression and GAD-7 to screen for anxiety. And GIH CDSA stool test is a comprehensive testing that actually lets you know how much digestive enzymes are you producing. If you are one of my patients, you've heard me say this, where I say there's 3 living juices that you need to live. 1 is digestive enzyme, 2 is brain neurotransmitters, and 3 is our hormones. They're mowing out there, so I'm going to shut the window for 1 second. And if you guys want to shout out and answers or questions or whatever, one of the times. Yeah, do that. Do we have any questions so far? Are we good? All right. So in terms of like what we do, that's going to be also already the future, is that we often offer like continuous glucose monitoring on breathalyzers like Envoy, in-home sleep studies like SNAP, and basal heart rate and heart rate variabilities to figure out what your biometrics are. And there's lots of biosensing wearables out there: iWatch, Galaxy Watch, Amazon wristbands, rings, bracelets, earrings, all of that. And we do send out in-home test kits, whether it's blood or saliva or stool or urine. And then we don't have this yet, but if there's a way to sense all that and automatically notify your doctor and then subsequently like prompt a telemedicine visit automatically, that would be truly life-saving measures at times. That's going to make a huge difference in your aging health. All right, so we're going to talk a little bit about CB on 7 pillars of health. And I want to say that daily choices that you make your health span match your lifespan. Let's this. Okay, which one of these can we actually control? There is choosing to eat more plants and stopping to eat at 80% satiety so that you're not overstuffing your body and increasing your insulin resistance. There's limiting your alcohol, you have full control of that. Choosing to stand instead of sit when you're doing sedentary work, so moving more naturally throughout your day, exercising, choosing to exercise makes a difference. Stress, downshifting at night, prayers, meditation, gratitude, hot bath, whatever makes you happy and sort of de-stress from your workday is a crucial step. Sleeping 7 to 8 hours a day, and if you had an adequate sleep, taking a nap, even if it's a short 20-30 minute nap, that's a good way to decelerate the stress, because in your sleep, you're repairing your DNA and mitochondrial dysfunction. Some of the environmental toxicity is really not that easy to control, like pesticides and heavy metal toxins and mold, but some of the environmental toxicity you do have control over are smoking and medications that you have to take. Medication always is a double-edged sword, and there are pharmaceutical medication that we do believe in that really helps us to save lives, and there are unnecessary medications that we take that sometimes does more harm than good. So distinguishing that with your doctor and figuring out what medications to be taking is. We're going to talk about social a little bit, belonging into the right tribe, sense of belonging, loved ones first. The aged parents in Asia or certain parts of the country, parts of this world, is often welcomed into their home as opposed to going to nursing homes. Those aged parents actually do much better than people who do go into nursing homes. Having a stable life partner adds about 3 years to your lifespan. Having a good tribe of friends that you share your interests with adds about 7 years to your lifespan. Having sunlight, having nature, boosting up your vitamin D is another factor. And this is perhaps another very important one in decelerating your aging process, is really knowing your purpose in life and waking up to a purpose. Why do I wake up every morning? There's got to be an inspiration greater than yourself that moves you. There's got to be a spirituality that backs you up. It may be something else like purpose, but this is the reason why I wake up every morning is something that we, when we talk. The moment we lose our purpose, then it becomes kind of. So, all right. So we're going to hone it down to brain age, because that is something that I want to talk about in a little bit more in-depth detail. We do genetic testings here, and one of the genetic testings that I do offer everyone is ApoE4. So there's ApoE2, ApoE3, and ApoE4. Like 25% of us, that means 1 out of 4, have one copy of ApoE4 in our genetics, and 2.5% of us carry 2 copies. If you have 2 copies, which means you got 1 copy from your parent, both parents gave it to you, that means 51% of people who have 2 copies will develop Alzheimer's disease by age 85, and 30% of individuals with 1 copy will develop Alzheimer's disease by 80. That's pretty significant. So even though genetic only accounts for 25% of the chronic illness process, I do want to emphasize it's a good genetics to know so that you can actually defy your genetics and beat it with lifestyle. And if you don't take away anything from this talk, one thing that you should take away from this talk is actually one easy, simple thing that you can do for yourself, increase your longevity, is to just eliminate sugar. So fine, refined white sugar should just go, reduce sugar, reduce sugar, reduce sugar. Insulin resistant is like directly related to stroke, dementia, diabetes, cardiovascular risk. There's a book by functional medicine neurologist David Perlmutter, is NYU Langone, called Grain Brain. He talks about it in pretty detail. He gives you like 4 weeks plans of dietary meal plan changes to reduce sugar, and I think it's pretty effective. And another thing that you could do is probably increase your protein, whether it's infrastructure gain of your muscle mass or supporting your brain neurotransmitter. Protein plays a pretty crucial role in decelerating your age. So maybe a pretty boring slide, so I'm gonna try not to spend too much time on it. But for those of you who have a medical background, there's 3 longevity pathways that you should be aware of. One is the sirtuin, which is NAD-dependent enzyme that controls our metabolism. There's something called metabolic aging. Some people just age more acceleratedly with our metabolism, hence they gain weight, hence they get diabetes, hence they develop insulin resistance, hence they increase their inflammation. But sirtuin gene, when it's activated by cold therapy, cryotherapy, dunking yourself in the cold after your shower, all of that, NAD and resveratrol can actually increase your insulin sensitivity and reduce inflammation and do the opposite. So that's something that we should know about. 2 is mTOR. This needs a lot more research, but a lot of research has been done on fasting. It's a protein kinase activated by insulin, but inhibited by fasting and rapamycin. I have never prescribed rapamycin before. It has this hype about how rapamycin can actually increase longevity. I still feel uncomfortable prescribing it, but fasting, certainly we have been promoting it in our practice for a while, whether it's in intermittent fasting or fasting mimicking diet for 5 days. Fasting definitely inhibits the mTOR and sort of regenerates your stem cells to be more active. There's also an AMPK, which is a cellular energy sensor. It's activated by energy, importance of movement, again, caloric restriction, and metformin. So we'll talk about metformin a little bit as well. Let's go into what can I actually take. So we talked about sirtuin so that I can explain NAD to you. So NAD is nicotinamide adenine dinucleoside. So this is mononucleoside, this is dinucleoside. It regulates our energy metabolism. It improves our mitochondrial metabolism. It's related to age-related weight gain. It enhances activity, and it also improves eye function. You could take it in an oral form, or you could get it in an IV. There is many supplements out there that are NR-based and NMN-based. Some of you are already on it. People who are on NMN is going to have a little bit of harder time finding their supplement suppliers because FDA just banned it, saying that it's too much of a medication-like supplement. Sometimes they lift it up after investigation, but at the moment, people are having a hard time finding it. But NMN is merely precursor to NAD that are more that are found in broccoli, kale, arugula, avocado. It's an added phosphate group to NAD and NR actually. It's a little bit larger, so it's a little bit more stable. There's plenty of NR supplements out there as well, and this only has like 5 studies that's proven to extend lifespan. Generally very safe to take, no toxicity. We do see mild side effects when we infuse. We've seen nausea, we've seen vomiting, we've seen chest tightness, we've seen diarrhea, we've seen flushing. Rarely with oral supplements, people feel side effects. Interactions with medication, blood thinners, and diabetes medication. Another supplement that I could recommend, or IV that we can recommend, is brain power. Main ingredient here is really phosphatidylcholine. So these are phospholipids, meaning they're building blocks of brain phospholipid layer, crucial structural components to neuron synapsing and communicating. Also has antioxidant protection, and there's carnitine in here, which is an amino acid that increases your cellular energy production and mitochondrial support. And there's antioxidants such as ginkgo biloba, which enhances your memory, and coffee fruit extract. Resveratrol is like really deeply talked about in Lifespan, David Sinclair's book, Natural Component Found in Grapes. There's some anti-aging effects associated with it, reducing inflammation, stress. We are in the middle of developing a supplement that has all of these called My Age. It hasn't been out yet, but we're planning on putting some sort of an NAD variation, some sort of a resveratrol extract, and epigenin and spermidine and phosphorus. All right, so what medication can I take, or am I willing to take medication for longevity? So if there's one medication that I will prescribe to you, and some of you are on it, it would be metformin. It's cheap. It's been out for a very, very long time. It is probably the cheapest, oldest medication we use for diabetes. There's been studies that says lifespan increases by 6%. That means 5 extra healthy years. It also protects you against cancer, especially lung, colorectal, and breast cancer. Reduces by 4%, dementia reduction by 4%, cardiovascular reduction, event reduction by 19%, depression reduction by 16%, and just frail overall weakness goes down by 24%. It works by AMPK pathway activation, and it increases in rapamycin. I'm not quite comfortable prescribing that, but I know doctors that do prescribe longevity. It's a medication that we use to prevent organ transplant rejection. It does decrease your muscle mass. That's probably my biggest hindrance in prescribing it. It has shown to increase lifespan in mice, but it's really not yet quite proven and studied. All right, we do hormonal therapy. I've gotten some questions in advance on hormones and peptides. We offer like bioidentical hormone creams, andro patch, andro gel, testosterone injections. We do pellets. We do peptides. We do sormelin, oral troche under the tongue, CJC, ipamolin, BPC-157 for people with injuries on ligaments and tendons and muscle tears. We do thymosin beta for autoimmune diseases. Works pretty well. Haven't seen too much of a side effect, and people do notice age reversing, whether it be skin or how they function or how they feel, or just repair mechanisms boosted when you're on peptides. So peptides are not human growth hormone. They are human growth hormone stimulants. So it stimulates your own human growth hormone to go up, and by doing that, kind of restore youth using these amino acids. We do regenerative medicine using PRP, stem cells, and exosomes. And I want to conclude by sort of like giving you concrete, what can I do, whether you come here or not? And takeaway points are: eat less, try intermittent fasting or fasting mimicking diet, empty stomach 3 hours before you go to sleep, at 80% satiety and you stop eating, chew more, use digestive enzymes, less sugar, less dairy, less red meat, all the inflammatory foods. Plant-based keto probably is the best, although it has to be really individualized and everybody's a little bit different. Try to gain more muscle mass and try to lose some of the fat mass, except for brown fat, which gets stimulated in the cold. Exercise, cold therapy, like that. Actively manage your stress. Doing nothing is not de-stressing. So we need to actively manage your stress, whether it's meditation or pray, or actively trying to control your sleep hygiene so that you get 8 hours a night. Keep nature near, whether it's oceans or trees or walking barefoot or sunlight. 20 minutes of sunlight has proven increase your happiness. Walking in the ocean or by the shore really does recharge with electrons. Some of you have heard this from me before, but the whole rest character in Chinese character is human by the tree. Having nature near us definitely makes a difference in de-stressing, keeping your loved ones close, aging parents, life partner. There's a term in Japanese called moai, which is a term for group of lifelong friends sharing social, financial, health, and spiritual interests. My tennis group is one of them. It really does give me a lot of support and happiness. Get tested for whatever you can, especially ApoE4 gene. Get biometric monitoring devices. Take some supplements that suits you. Consider taking metformin, doing NADIVs, regenerative hormone peptide replacement therapy might be helpful in overall deceleration of the aging. All right. So thank you for listening. I'm going to stop my share from here, and then whoever has questions and whatever, this is an open forum now. You guys can all unmute and start talking.
I have a question, Dr. Lee. You mentioned metformin. Is there how many months in a row can you take it, or is there any, short term that you can only take it for 1 month or 2 months?
So metformin, in order for it to work for your longevity, it is a long-term medication. I often just prescribe 500, which is a small amount, and sometimes I titrate it up. Generally, people feel a little bit queasy, a little bit of diarrhea as you get used to it. The first 2 weeks or so, you lose about 4 to 5 pounds when you do feel queasy and have a little bit of diarrhea, but it plateaus and you develop a tolerance and you become better and it doesn't affect you anymore. But it's generally a lifelong medication. It's not just 1 month, 3 months, 6, 9 months kind of a thing. It's years on end.
Thank you.
Anybody else have any questions? I think Kevin even sent in like a question. Have a question?
Yeah, it had something to do with the telomere, the testing you do for telomere.
I got it. Okay, so I have it. I'm gonna read it out. Telomere testing. Okay, so I do telomere testing. It's a blood test. It's one vial. Do you guys all know what a telomere is? So telomere is the end cap of DNA. DNA usually looks like two bunny rabbits with centromere inside in the middle. The end caps have DNA have all the information that you need to survive, but the end cap has zero information on anything that has to do with survival. Telomere just measures lifespan, and it's kind of predestined. Certain people are born with longer telomeres, and certain people are born with shorter telomeres. But if you actively manage your lifestyle, take supplements, take metformin, whatever, do NADIVs, whatever it may be, the telomere length does get elongated as you actually do those measures. And if you have traumas, disease, infection, whatever it may be, it does shorten with each event and it uses it up faster. It does correlate with longevity just a little bit. The result comes in like a distribution curve. So you kind of know where you fall within your age group. So that's a little bit helpful to kind of see, oh, where do I fall in my own age group? I've done it. I thought it was interesting. It's actually best if you do a telomere testing, then do like series of NADIVs or start taking an NAD or start taking metformin, and then a year later repeat it to see your post result. Has it gotten better? Has it worse? Trying to determine how long am I going to live, if that's what you want to know. The second question I have here is, as we age, what are the best habits to adopt? It's less sugar, no sugar. And what are the worst habit? That's smoking, I think. I think that's probably my short answer is like less sugar, no smoking. But really, like what actually, when we do the blue zone studies, the whole Okinawans in like Japan, like Sardinia in Italy, Costa Rica, California, some island in Greece, those 5 little longevity blue zone areas of the world, the biggest component is actually your tribe, your community. Like people with the same interests, gathering together and talking about what interests you. I have a Korean girlfriend a group that's been going on for like, I don't know, 15, 18, I don't know, going on 20, because we met when my first kid was really, really little. But we actually, that's a bit of a financial bank slash girlfriend group slash like go out to eat group where we gather once a month, we chip in a few $100s. We actually give a lump sum of money, like rotating, so that we kind of save, and then we go out and eat and chat and talk, and it's a blast. But it's like raising children together, like sharing some financial burdens kind of all together. Um, and talked about tennis groups. I talked about, I mean, everybody should have their own tribe of people that are like lifelong friends that you can count on and lean on. And that actually is the biggest factor in the blue zone studies. So find your friends, call your friends, and gather with them and meet with them. That's that. Have like specific I think I might email this person back because I don't think this person here, but it was about like healing from shoulder surgeries and specifically looking for BPC 157 and self-injecting and all that. And yeah, BPC 157 is 157 amino acids pulled together, really helps with ligament, tendons, bone fractures, muscle strains, and it just regenerates and restores a lot faster. Anybody else have any questions? Happy to wrap up if we're done.
This was very helpful. Thank you, June.
Hi, Jen. How are you?
Good. How are you?
Good, good. So she's my tennis wise. That's my group of tennis girlfriend. So, that kind of support definitely makes my day brighter. And I'm so happy that you're here.
It's always good to try to be healthy.
I know.
Learn more.
Yeah. I hope you learned something. I hope everybody learned a little bit of something.
Definitely. Definitely. Thank you so much.
All right, so I'm going to wrap up. Thanks for being here, and rest of you, we'll see you soon.
All right. Thank you.
Bye now. Bye.
Bye,
Thank
everyone.
you, Dr. Lee. Bye.
Bye.